COVID-19, obviously, as you know, it's a spiral infection. So in terms of cutaneous manifestations, not unlike other viruses, you can see what we would call like a more biliform type eruption. So sort of like a measles type rash, although those are not really as common. What we are seeing and has been reported in different locales, and this is a kind of interesting thing, is in Italy and in France, they're seeing about 20% of patients have been reported to have some sort of cutaneous manifestation. And when you look at those 20%, they kind of fall into two or three little categories. And it makes sense when you think about the other signs and symptoms of the disease. So one of the things that we see in patients are urticaria or hive-like eruption. So a faintly red or faintly erythematous blanchable eruption, which means you rub it and it goes away fairly quickly, not unlike your measles type of rash. So that's one of the things that we see. So we see an urticarial type eruption or hives. You can get a deeper, more deeply red, non-blanchable eruption, which we would call purpuric. And that means that that's involving the blood vessels or the vasculature. And so what we're seeing in some patients in France and in Italy especially, which is telling us, that might be a different cohort of virus. So China has certain manifestations in terms of skin things, and we'll get to that. And Italy and France seem to be different. And we're thinking that the virus that we're having predominantly in the US is more from France and Italy. And so what we're seeing here is this urticarial or urticarial-like vasculitis, which is transient. And that ties in with the neurologic symptoms that I'll come to in a minute. So we see urticaria, we see hives, we see what would be called a leukocytoclastic vasculitis, or purpura or petechiae, which are like vascular, the blood vessels bleed into the skin and you'll get these purpuric little eruptions. So those are the big ones. The other thing that we're seeing in younger patients, and this is rather interesting, is we kind of see this pseudo vasculitis. So they might get a purple toe. A toe will go cold and it gets kind of purplish or red, or you'll see a finger, or so an extremity, so more acral. And so you'll get this very deep, non-blanchable red purpuric looking lesion, and then within a day it goes away because it's involving that blood vessels and the neurologic things. So people are seeing neurologic manifestations like TIAs or mini strokes and stuff like that. And when you occlude the blood vessels, and you'll do the same in the skin will go white, and then it gets kind of purplish, and then the next day it goes away. So in younger people, adolescents and adults, we're seeing this acral purpura. And the timing of the eruption is such that about 40% of patients who are getting it will actually get it at the time of their other symptoms. So at the time of their fever, their cough, their bad headaches, their, those other things. But about 60% are coming out after they're hospitalized. And what we're thinking now is the reason that it wasn't so prominent was that most people, they got really sick, they got admitted to the hospital, and everybody, rightly so, is worrying about the death and dying part of this and taking care of these people who have significant pulmonary issues, respiratory compromise, that nobody was looking at the skin. As many of our residents got mobilized to go to staff the ER or the emergency department, or they're working on the floors, they're paying attention to the rashes that these people get. And so now, as we're getting more comfortable in taking care of patients, we've gotten a few consults for the skin rash that's coming up during the time of their illness.